Clinical conversations on today's Smart Chiropractor show. We held Axis 2021 a few months back in 2021, and that was our online clinical event. We had an array of awesome chiropractors and speakers come on and talk about clinically relevant topics. During our clinical conversations on Smart Chiropractor Show, we've been revisiting some of those highlights, and today will be no exception. We're going to take a look at Dr. Jason Sonner's talk on hyperbaric oxygen therapy. Fascinating, and Jason knows a lot about this topic. So if you've been interested in it, if you'd love to learn more or geek out, stay tuned because we're going to press play momentarily on a 10-minute clip from his talk at Axis 2021. But before we do, I want to encourage you to stay tuned as we will shortly be releasing details for Axis 2022. So we're going to hold Axis 2022, an online clinical event coming up later this year. Details will be emerging soon, but until then, you can get a taste with what other docs tuned into during Axis 2021.
Trauma or chronic injury or neurologic disease, degenerative neurologic disease. This system is something that we see in so many different patients. Usually, and we could start anywhere on this cycle and continue, but we'll start with decreased blood flow for a number of reasons: toxicity, trauma, whatever the issue is. We get a decrease in blood flow. As a result of the decrease in blood flow, we get an increase in inflammation. The body can't get oxygen into the area, and it can't pull the waste products away. And so literally those cells start to bathe in inflammation. As a result of that increased inflammation, we end up with metabolic dysregulation. Now the cells can't utilize or make enough energy, ATP, through the mitochondria because it's not bringing in all the nutrients that it requires. As a result of this metabolic dysregulation and the inflammation building up, we begin to get immune system dysregulation. We get an increase in oxidative stress, leading to either genetic or epigenetic damage, and then eventually cellular damage, and then tissue damage. And as long as we live in that cycle just continues to repeat itself, where tissue damage then goes back to capillary damage, which would further decrease the blood flow, which will further increase the inflammation, and so on. And so this is the chronic illness cycle that we see in so many, sometimes in ourselves or our family, but in so many of the patients that we all treat every day. So what is hyperbaric oxygen? And exactly why is it that I keep saying that hyperbaric oxygen can do something that nothing else can do? Let's get into this. It's all about creating a reservoir of oxygen, more oxygen than we could normally get under normal physiologic conditions. What does that mean? We've all had a pulse oximeter put on our finger before. And ultimately, what is that measuring? That's measuring the percentage of our red blood cells that actually has oxygen attached to it. And so most of us, if you don't have a cardiovascular issue, no lung disorders, for the most part, we're all living somewhere between 96 and 100% oxygenated on our red blood cells, meaning, we can handle maybe 1 or 2 or 3% more oxygen at any time, relative to the amount that we're actually all getting. And so ultimately, we're very close to fully saturated. And what's interesting is we need to be fully saturated virtually every minute of every day just to have normal cell function, normal physiologic function. And so I look at oxygen as a nutrient. Again, we talked a little bit about deficiency. I believe that oxygen at times we could become deficient in. So let's talk about that concept. It's interesting that when it comes to food or water, right? Food, you could go days, you can go weeks, you can go months without eating food and be totally fine. Water, we can go days without water and still survive. But oxygen, we can barely go minutes without resupplying ourselves with a normal amount of oxygen, meaning we need to be almost 100% saturated every minute of every day just to have normal function. Meanwhile, we virtually have zero reservoir of extra oxygen to hold us over, God forbid something go wrong. And so oxygen is not only a nutrient, it's a critical nutrient. It might be the most important nutrient that we get when it comes to cell function and ATP production. And like a vitamin, there's a continuum. Let's use vitamin C as an example. If you don't get enough vitamin C, you could become vitamin C deficient. There's a very specific name for that. It's called scurvy. Meanwhile, so you'd want to get at least as much vitamin C as you would need not to get scurvy. So that's typically the RDA. The RDA is the amount of a vitamin that you need to make sure that you don't show deficiency or sickness as a result of not getting enough. So you'd at least want to get enough that you don't experience scurvy. Likewise, you might want to get a little bit more because you don't want just the minimum amount that you need not to get scurvy. You actually want the optimum amount of vitamin C needed to perform all the different functions that vitamin C does inside of our body. Beyond that, even if you're getting the optimal dose basically every day, there might be times periodically where you choose to mega dose vitamin C well above RDA or well above the optimum range to make sure that you have enough to deal with some issue. Maybe you're going to take more vitamin C because you think you might be getting a cold, or in some cases, somebody might do IV vitamin C, very high dose IV vitamin C because of a condition, let's say like cancer. And so there are these periods of time where mega dosing the vitamin C becomes critical to that patient's recovery. I look at oxygen very similarly. We need a certain amount of oxygen, and if we're not getting that oxygen, we become deficient. A deficiency in oxygen would be called hypoxia. So we certainly want to get enough oxygen not to become hypoxic. And more so, we want to make sure we're getting the optimum range of oxygen on a regular basis. And basically, again, without any heart issues or cardiovascular issues, the optimum range of oxygen is roughly 100% saturation of our red blood cells. Now, even if we're getting close to 99 or 100% saturation in our red blood cells every day, there might be times periodically megadosing oxygen becomes critical for a patient's recovery. Now, the thing is, there's no way to get more than 100% saturation. 100% is 100%. The only way to get more oxygen into a patient's body than the 100% that they can absorb to their red blood cells is to increase the pressure of their environment. When you increase the pressure of our environment, we change the pressure gradient of how oxygen is absorbed into our body. And that is why hyperbaric does what nothing else can do. So we're going to go through a process to explain that a little bit more detail. The first picture you see shows, a mountain to the left, and then the sky, and those little blue bubbles are just oxygen bubbles. And so what we're trying to show here is that as you go up in altitude, as you climb a mountain, and people know this, if you go to Denver, we all say that there's less oxygen at altitude. That's not exactly true. It's not that there's less oxygen percentage. Oxygen is 21% of our air, whether you're at sea level or whether you're at the top of Mount Everest. Air is 21% oxygen. However, as you go up in altitude, what's happening is you're losing pressure. And so as you lose pressure, those molecules start getting further and further apart from one another. So when you take a breath in, you're just breathing in less molecules. There's less of a driving force of oxygen into your lungs. Likewise, as you descend back towards sea level, those molecules get closer and closer together. And when they're close together, like at sea level, and if you're adapted to sea level pressures, that would get you your 100% saturation of your red blood cells. And so here's just the oxygen surrounding a capillary, let's say in your lungs. And there's a pressure, even right now, I'm at sea level. There's a pressure of my atmosphere, 1 atmosphere. The pressure of 1 atmosphere is enough to start driving that oxygen into the plasma of my blood. And once the oxygen gets into the plasma of my blood, it can get attached to red blood cells and carried throughout my body. As it does that, the red blood cells attach themselves. The oxygen basically is absorbed into the red blood cells, carried throughout your body. And ultimately, this is what we're measuring when we use a pulse oximeter on a finger to show this is the percentage of my red blood cells that are full with oxygen. What's the difference? Well, there's 2 laws. There's really 5 gas laws that govern hyperbaric, but 2 main laws that we talk about the most. So the first one is Boyle's law. The Boyle's law says, as I compress a gas, I can make that gas into a smaller volume. And so those 2 pictures on the side, the first one under Boyle's law is showing that as that bubble is going down in depth, it's getting smaller and smaller, because as I go down in depth, the pressure goes up. As the pressure goes up, the size of the volume goes down. The second gas law is Henry's law. Henry's law says once I pressurize that gas and I decrease its volume, if I hold that gas over a liquid, I can dissolve that gas into a fluid. The easiest example to understand is a bottle of seltzer. If you looked at a bottle of seltzer before you opened it, if it had no label, it might just look like water. Until you open that and release the pressure, do you start to see those bubbles coming up. And so what happened was they pressurized a gas. In that case, it was carbon dioxide, and they used water. So they pressurized carbon dioxide, they held it by the water. And so the water absorbed all these bubbles, and then they capped it. As long as you capped it, you trapped all of that gas inside of that liquid. Then as soon as you open that cap, the bubbles start releasing. That's the carbon dioxide coming out of solution. Now, the same thing happens in a hyperbaric chamber, except the gas we're using is oxygen instead of carbon dioxide. And the liquid that we're using is your blood, the plasma of your blood, instead of water. And so when you're in that chamber, you're infusing the liquids of our body with excess oxygen, which is trapping all that excess oxygen into our body. And when we get out of that chamber, they start coming out of solution and also interacting with our cells. And so in a hyperbaric situation, we call it hyperbaric oxygenation. So this increased oxygen, because of this increased pressure, we are able to massively increase not only the pressure, but also the percentages of oxygen. And as we increase the pressure and the percentages of oxygen inside that chamber, we could massively increase the amount of oxygen that's being inhaled and the amount of oxygen that's ultimately being absorbed into the plasma. Now, typically, all of the oxygen in our body right now is being carried on a red blood cell. In the hyperbaric environment, because we're dissolving so much oxygen into the plasma itself, which normally carries very little oxygen, becomes almost an unlimited reservoir of extra oxygen that it can hold because of this excess pressure and the amount that we can absorb into the liquid of our body. And so if we just remember some chemistry rules, Diffusion is the movement of molecules down a concentration gradient. Things always move from high concentration to low concentration. This first picture just shows us that whatever there is of pressure or oxygen in the lungs should basically equal the amount of oxygen pressure that eventually will get to our tissues. The rate or the power, the amount of diffusion that occurs is relative to the pressure gradient. So as we increase the amount of molecules that we're breathing into our lungs, with the second picture showing us, it creates a massive shift of pressure gradient. And because the amount of oxygen in the lung is so much greater than the amount of oxygen in our tissue, we're able to suck that oxygen right into our capillaries and dissolve that into the liquid of our blood, ultimately reaching our tissues. And those molecules will continue to move at that rate or that speed because of that change in pressure gradient, all the way until tissue reaches the same saturation as the lung. And so depending on how much pressure we use, depending on the percentage of oxygen we use, and the amount of time that we're in that chamber, those three variables dictate this entire process of improving or increasing the amount of oxygen available, the amount of oxygen we could ultimately absorb into our bodies and into our tissues. What this graph is showing, I pulled this from a study, but it's basically showing two groups, the hyperbaric treatment group and the non-hyperbaric treatment group. And what you can see is those two, on the bar graphs, there's two white lines, and they're basically, whether you were treated with hyperbaric oxygen or not, those two white blocks are virtually the same size. And really what that's saying is, if you're close to 100% saturated, you're 100% saturated. There's really nothing else.
All right, that was a preview looking back at Dr. Jason Sonner's hyperbaric oxygen therapy from Axis 2021. I could geek out on this topic forever. I love learning about it. I think it makes so much sense. If you have more of a performance recovery-based chiropractic practice, this makes so much sense. It can be sold, quote unquote, a la carte. It can be a membership model. And it is just one of those things where the first time I think I saw it was NBA guy had one at home on like MTV Cribs like 15 years ago, and it instantly got my attention. And I think it's really cool to see chiropractors exploring different avenues that tie into recovery and performance in and around their practice. Not for every doc, but if you are interested in those two words, recovery and performance, I think it is something you need to take a look at. Jason?
One of the things I love about the Axis event, and, this isn't a great example, is, our program is called the Smart Chiropractor. Our agenda is to make chiropractors smarter. And we think that's a good and important thing. And whether you're the kind of chiropractor that watches that and goes, that's interesting, I think maybe I'm curious to learn more about doing it. That's one option. You may be the kind of chiropractor that says, wow, that's really interesting. I don't want to do that, but now that I know more about it, I should find a place to refer to. Or you may say to yourself, well, that's interesting. I'm not really going to be referring, but at least now I know and I understand better when people ask me, hey, what's hyperbaric all about? And they look to you as an expert. You are well informed about today's sort of relevant clinical skills and things that are out there that people are going to ask you about. And the more knowledgeable you are about these things, we think the better that is for you and for your patients or clients who depend on you for this type of advice and information. So Jason's a great dude. He's got a lot of good stuff going on. And to your point, Jeff, that you brought up, one of the reasons he made the pivot was very much because of this concept of recurring revenue and being able to offer services that doesn't require him to be bending over the table day in and day out. And that's one of the things when you get out of school and get some financial obligations and maybe even some emotional obligations like kids and family and all those things, the idea of being able to generate revenue beyond just the times and days that you're in your office, bending over a table, providing services, at some point might be a really important thing for you to consider. We'll suggest rather than later, you should think about it. And this is one of many different options that you have, but it's a very good one. And you will see, if you don't want to do this, that's okay. You will see more and more membership programs. In fact, last week, I featured a membership program down in Southern California that offers a whole suite of different types of these types of services. Laser services, cryotherapy services, hyperbaric services, sauna, etc. People will be joining memberships for other places in your community very soon. And that's your choice. Do you want to be the place that they come? Do you want to refer people to these places and maybe have a cross-referral relationship? Or do you just want to be knowledgeable about them? We're going to always encourage you, make sure you start thinking about monthly recurring revenue for yourself, for your practice. That is your key to freedom. And hopefully you learned a few things there to maybe inch your way forward into taking some action.
Indeed. And be sure to stay tuned for details on Axis 2022 coming up shortly. Jason, thank you so much for presenting at Axis 2021. Thank you so much for watching this video on the Smart Chiropractor. To not miss a single thing that's clinically oriented, marketing oriented, or more, be sure to subscribe to our YouTube channel today.